global controls will have to be imposed, and a world governing body will be created to enforce them. Crises precipitate change.
Secretly plotting your demise. I want to devise a...
Hello everyone, Darko 2012 here with Global Government News. I'm covering an article from Bloomberg, and it's titled States Sue Over Overhaul That Will Bust States' Budgets. So many people are calling this or dubbing it Obamacare, and this has nothing to do with Obama at all because it is about eugenics and eugenics care and about continuing this corporatist style government / economy. So I'm not going to say it's Obama's idea and the socialist agenda. No, it's about fascism, it's about corporatism, it's about globalism, it's about feudalism. It has nothing to do with this one person, this one individual. See, it's just because he's in office that they're able to get away with this. But there's a lot to cover in this article, and I recommend you check it out on your own time when you get some more time. I'm going to try to cover just some of the basics here and throw in my comments. So thanks for joining me. It says President Barack Obama, or our Fuhrer, faces a fight over the healthcare overhaul from states that sued today because the legislation's expansion of Medicaid imposes a fiscal strain on their cash-strapped budgets. Yeah, so this is what just gets me, is that you got the Chinese over there saying, you know, you guys got to do what you need to do to make sure you show some kind of stability in your currency. You know, we do have a lot of money invested in treasury bonds and that. And so what do? Oh, we just go ahead and shove down this healthcare bill that you know, a strong minority of people didn't want in America. And while our economy is, you could say, oh, we're in a recovery, but I don't buy any of that bullshit. Do I want it to be really bad? No. But at the same time, while our economy is super weak and there is a possibility for a collapse of all the states going bankrupt and basically having no money, what do? We passed the biggest health care bill since the Medicaid in the 60s. So that's the way we do. That's the way we roll because, you know, like I said, it has nothing to do with healthcare. It has everything to do with eugenics. And then, of course, we are going to be having to pay money every month out of our income tax, and along with our employers, who are going to then offset that cost, if they pay for it, onto the workers. So it's just another way of transferring wealth to the rich elites who this fascist individual, Barack Obama, represents, much like Mussolini. So it says Florida, Texas, and Pennsylvania are among 14 states that filed suits after the president signed the bill over the constitutionality of the burden imposed by the legislation. The healthcare overhaul will make as many as 15 million more Americans eligible for Medicaid nationwide starting in 2014 and will cost the states billions to administer. States faced with unprecedented declines in tax collections are cutting benefits and payments to hospitals and doctors and Medicaid, the healthcare program for the poor, paid jointly by state and U.S. governments. The cost to hire staff and plan for the average 25% increase in Medicaid rolls may swamp budgets, said Toby Douglas, who manages the Medicaid program for California, who hasn't joined the lawsuits. Says the states are coming through the worst fiscal period in the history of record keeping, said Vernon Smith, a former Medicaid director of Michigan. Says Medicaid is the most significant, most visible, and most costly part of this expansion, and states fully expect to see increases in their spending. As far as California's deficit, it says California has a $20 billion budget deficit. The extra load will cost at least an additional $2 billion to $3 billion annually. And that was the chief deputy director for California, like that, I even said that, healthcare programs. We face enormous challenges just sustaining our existing program, said Douglas. I just don't see states having the capacity to move forward on these changes. It moves down here, it says Medicaid recipients are projected to increase 4.3% to 7.3% million in year 2011, which begins July 1st. The courts, as far as the legal aspect of this story goes, says the courts challenge Douglas's state is battling in court over Medicaid spending cuts it tried to make this fiscal year. The Ninth U.S. District Court of Appeals on March 3rd barred California from reducing payments to doctors and hospitals, saying federal law required states to maintain, quote, equal access to basic health care for the poor. It says the federal government mandates that states provide health coverage under Medicaid to children, pregnant women, and the elderly and disabled poor. The health care overhaul that was just passed simplifies the system by setting a minimum national floor and requires that all states cover childless adults who will make up almost all of the expansion enrollees. Moving down here, Florida will have to spend an additional $1.6 billion for Medicaid and hire 1,000 new workers to accommodate the overhaul, the state's Attorney General Bill McCollum said yesterday in Orlando, Florida. This is a bad bill, he's quoted as saying. That's a political determination and a practical one. The states that sued are Alabama, Colorado, Florida, Idaho, Louisiana, Michigan, Nebraska, Pennsylvania, South Carolina, South Dakota, Texas, Utah, Virginia, and Washington. The complaint posted on the Florida Attorney General's website called the legislation a, quote, encroachment on the sovereignty of the states, because they can't do it on a case-by-case basis like they used to be able to. It said that Florida will be asked to, quote, broaden its Medicaid eligibility standards to accommodate upwards of 50% more enrollees. As far as the insurance mandate goes, it says besides the added Medicaid costs, the states are also challenging the right of the federal government to impose a mandate requiring individuals to buy health insurance. This is what a lot of people were talking about before the bill was even passed. Virginia Attorney General Ken Cuccinelli, whose state filed a separate lawsuit today challenging the law, called the health legislation a, quote, unconstitutional overreach of the federal government's authority. And that's why I was saying before, where the insurance companies actually benefit out of this. They want this bill passed. Because, of course, in a corporatist society, corporatist economy, big corporations love big government because they allow them to impose regulations which squash competition and then make them into nice little duopolies and whatnot. So, but yeah, the insurance companies wanted this bill because it allowed them to legally refuse people coverage because of all the stuff that's thrown into it as far as the insurance goes. And then, of course, you have to pay a lot of money if you don't get insurance, either privately or you'll have to go to the governments, and, you know, of course, they're going to charge you a lot of money with fines or possibly throw you in jail if you don't get it. So, but it says that the historic healthcare bill, which passed on March 21st after 13 months of debate and discord, marks the biggest expansion of healthcare coverage since the enactment of Medicaid and Medicare in 1965. And of course, just like all the other criminal-ass bills that the legislators try to pass and do pass, or right under $1 trillion, which is just a hunkin' number that they just pick out of their asses, $914 billion, because it's just, like they said with the bailout, a really big number. But it's not so big that it scares the American people, and they don't want to put it into a $1.5 trillion. No, they always go $700 billion, $800 billion, $900 defense $billion, defense spending bill. So, but yeah, so moving down here, it says falling state revenue. Most states have confronted drops in revenue since the beginning of the recession in late 2007 as tax collections fell for an unprecedented fifth straight quarter by the end of December last year, according to the Nelson Rockefeller Institute in New York. In the first 9 months of the 2009, states suffered the biggest decline in revenue ever recorded. It says in fiscal 2009, Medicaid enrollment increased a record 3.29 million nationally, with another rise of 1.2 million this year. Medicaid spending accounts for about 22% of the state spending. And so we forgot about the other big corporations that will profit from this, which will be what? Our buddies, the pharmaceutical companies. Yay, eugenics.